start on the lecture today, which is somewhat of a fun one. Today we're talking about marketing. So we think in terms of healthcare, who is our customer?
Patients.
Patients, vendors,
Possibly some of the employees that might buy it.
employees,
People we get our supplies from.
who we get our supplies from. There's one you guys haven't said yet.
Employer.
Provider.
Employer.
Provider. So nurses, physicians.
Because you have to attract the trained personnel that you need to in order to expand or improve your business.
Right. So those are all customers. Is the customer the ultimate consumer? Yes and no. In some cases, it may be. If we're talking about employees or providers, maybe not in every situation. But it's important for us as healthcare professionals or healthcare managers to know who all of our customers are so that we know how to appropriately serve them. So what we're going to do is we're going to watch a quick video. You could please hit the lights.
Got them working?
I think so.
That's almost like the same thing as bringing in more customers for like a retail business, because a lot of any business, you got word of mouth is your most economical and usually the most beneficial form of advertising. I had friends that just moved out here from Fort Lewis and they are looking for a furniture store. I told them one that I had gone to that had good products and delivery was satisfactory, they had great customer service. They went there and then they wound up buying a living room set and a whole bunch of accessories and wound up on their VIP program. You know, it's just little things that you can do. It's like if you go someplace where you've gotten food poisoning like at least twice, you may not recommend that place to somebody else, but if you go someplace and the wait staff has your beverages within 5 minutes, you have your appetizers within 10, I mean, the service is phenomenal. You're gonna be singing their praises to the moon and back. It's the same thing with a medical clinic, dental clinics. I mean,
It's like first impression is the best.
it is.
Yeah. So, and as competition continues to increase within the healthcare market, you're going to see how important referrals are to a business or how important they can be to a business. So first we're going to step back a little bit and kind of talk about the beginning of marketing. Healthcare marketing kind of came into play a little late if you can consider how long it's been within other companies or other industries. Before the 1980s, there really wasn't much healthcare marketing. And at some point, since we're business as well, we started to realize we need to get out there as well as other industries to market our products and our services and our positions and all the things that we offer at our organization. Well, the problem was that there was a little bit of conflict within some people because they felt that marketing in healthcare was unethical. Can anybody see that side or see why people might have felt that way?
Maybe they're worried about releasing too much of patient information or something.
Too much
like
patient
that. Too much
information.
demographics to where you can identify somebody. So maybe they're worried about crossing the line into HIPAA issues.
Yeah, it's possible. You know, as healthcare professionals, we deal with a lot of confidential and private information. So that's one take. You know, another take is you have to remember that in our industry, we deal with people, we deal with lives. So you have to be very sensitive to those issues when you consider marketing in certain areas. So how's marketing defined? It's defined as the activity, set of institutions and processes for creating, communicating, delivering, and exchanging offerings that have value, keyword value, for customers, clients, partners, and society at large. So at the beginning, I had you guys kind of define who our customers were, and here again in this definition, they also kind of summarize who customers can be. Effective marketing and good marketing leaves satisfied customers, right, or satisfied patients. So when we're thinking in terms of marketing, we always want to make sure that the end result is a satisfied customer. Marketing is intended to build relationships, build referral relationships between the organization and people in the community. And the most important types of relationships are long-term. We want long-term customer relationships because those are the ones that tend to be more loyal. Those are the ones that tend to do our referrals. So we want to build long-term customer relationships within marketing. Social marketing is a little different. It still falls under marketing, but it deals with a change, some type of behavioral change or a certain target audience. So a good example of social marketing is Susan G. Komen. Does anybody know what that is?
Foundation.
Yes, yes. So that's the whole breast cancer awareness initiative. So that's an example of social marketing. And then we have cause-related marketing that is where a for-profit organization will link with a certain cause or issue. So some examples of that are Nike and maybe the cyclist Lance Armstrong with the whole Live Strong initiative. It was a collaboration between a societal issue and Nike, which is the for-profit organization. So that's an example of cause-related marketing. You know, in hindsight, he may not have been the best person to use in that marketing initiative, but at the time, we didn't know that, so. So if you have not heard of these before, at some point you will hear about these, the 4 Ps in marketing. If you take a marketing class, you'll hear it again. The 4 Ps, the first one is product, or service. In our situation, it would be service. So product asks, what does it satisfy, or what features does it have? So basically it's describing the product or the service. So that's the first P. The second P is price. So what is the value of the product? What's the cost? What's the price? How does your price compare to your competitors? The third P is place. So where would your customers look for the product? Is your product only in a standalone building? Is it offered online? So where? And then promotion. Where and when and how can you get your message across to your target audience? So basically, what is the means of you relaying your message? Are you going to do it through radio or television or billboards or the internet or social media? So these are the 4 Ps of marketing. Whenever you're creating a marketing initiative, you always want to consider these 4 Ps. You can't leave any of them out. You always want to consider each one. And once you've covered each of these, then you know you're on the right track to building a successful marketing initiative. So these are very important. If you would write down anything today, that would be one thing that you should write down. So there's some uncontrollable factors in marketing that we have to consider. And they're not things that we can control, but we do have to take them into consideration when we're creating our marketing. And some of them are political, economic, social and cultural, technological, regulatory, and competitive. And these are all important because if we cross a cultural line with our marketing, there could be negative backlash, right? We've all seen in the media sometimes where, I think something just happened with Coke, where they had those messages under the cap, and it offended somebody, and I think they...
What about that Cheerios commercial or that breakfast cereal commercial with the mixed race family? People were in uproar about it. I'm like, that's my sister's house. Why is that offensive? That's
so
everywhere.
Yeah, so you have to definitely, consider all of these things when you're creating your marketing strategy, because you have to think about, is it going to offend anybody, or are there going to be any technological issues with how we try to relay the message? So these are all uncontrollable factors that we have to take into consideration when we're marketing. So this is a diagram of how your marketing strategy process would work. I know it looks very confusing, but you'll see that at the bottom is the marketing mix, which is also another way to term the 4 Ps of marketing. And then, can anybody see what's at the top?
Organization purpose.
Organizational purpose, does that sound familiar to anybody? Somebody tell me about where that might sound familiar from?
Mission,
It's
value.
Right, so as you can see that although this week we're talking about something different, how that organization purpose affects everything we do from marketing to operations to financial. So at the top, we have the purpose, because we always have to consider what our organizational purpose is. And then in the middle is where we have all the things that affect the strategy. So we have competition, a target market, evaluation, implementation, continuous improvement, organizational analysis. So all the things in the middle kinds of affect our marketing strategy. Marketing management. It's one thing to create a marketing strategy, but after we've created the strategy, we kind of have to manage it to make sure that it's going well, to see if there's any changes that need to be made, if we need to select a different target audience, if we've already exhausted one audience. And so marketing management deals with that. It deals with selecting the right target markets. Everybody know what target audience or target market is?
Yeah, it's like you want to attract somebody, people between say like 18 to 25,
Right.
or 30 to 45. That just.
And there's
certain
all
age
different types of target markets. It could be age related, it could be gender related, it could be race related or religious related. So marketing management deals with trying to select the right target audiences and communicating with them, as well as making sure that they are able to see the value. Value is a very important word in marketing. You'll see it over and over again. But it deals with making sure that they can see the value of your product and that they can see why you're different from the competition. So how do we select that target market? Well, it deals kind of with segmentation. Segmentation, the formal definition is basically the process of dividing a big market, so a total market, into groups or segments. So if I were gonna do segmentation with this class, I might say, okay, this is one, this is another one, and that's another one. Or I could do it this way between rows or however you wanna do it. But segmentation means that you are dividing a total market into smaller subgroups. And then once you divide the groups up into subgroups, then you target. And that's how you create the target marketing. Now within targeting, you could have a specific concentration or a multi-segment. So a specific concentration might be pediatrics, just peds. A multi-segment might be, we're gonna treat pediatrics and adults. So once you target, then you kind of focus in and concentrate to try to decide how focused your target group is going to be. Positioning refers to the techniques that you use to try to position your brand image. So basically, this is how well you communicate to your customers. So for instance, Walmart, everybody know what Walmart is, right? Low price, right? They always advertise themselves as the lowest price. And then you have other companies like Mercedes, who's on the other end and kind of targets themselves or communicates themselves as a higher or luxury group. So positioning deals with how you want to position yourself within the market. So we're either going to position ourselves as the cutting edge hospital, which means we're a hospital with all the flashy technology and the new equipment and the new MRI machine, or maybe we're going to position ourselves in the market as the community hospital, so the one that reaches out to the community the most, the one that takes the underserved or the uninsured people. So positioning deals with how we decide as an organization to basically position ourselves in the market. So we have two different types of focus that we could take. We can take an organizational focus or a consumer focus. Organizational focus obviously concentrates on an organization or a large group of buyers. So an example is employers purchasing healthcare for employees. So in this instance, our focus would be the employer. So if we were going to focus on this school as the person that we marketed to try to sell healthcare insurance, that would be our organizational focus. Or we might focus on the consumer. If we were gonna focus on the consumer level, we would focus on each student within this organization to try to market our health insurance. So those are the two differences here between different types of focus. And you may have some instances where you're focusing on both. You may have some instances where you're only focusing on one. Again, that's all the decisions that are put into your strategy, your marketing strategy. A marketing plan. We talked a little bit about marketing plan last week. Here it is again because we're talking about marketing. So again, a marketing plan is obviously a written document that presents a plan as to how you're going to relay whatever your marketing initiatives are. The marketing plan could be short-term or long-term, so it could be a year plan or a 3-year plan, or it could be something long-term, so like a 10-year marketing plan, maybe where we are now and in 10 years we want to be doing X, Y, Z. Within the plan, it's very specific, and if I can try to find one, I'll email it out to you guys if I have an example of a marketing plan that I can show you, but it's very specific. It goes kind of line by line as to how they're going to do everything. So specific all the way down to we're going to run our commercial every Tuesday and Thursday at 6 p.m. or during the 6 p.m. news. So it gets very granular down to the nitty gritty as to how they're going to relay everything within their marketing initiative. And usually the plan can be updated or reviewed every year. This depends on the organization. Some may review it every other year, but it's a plan that is continuously reviewed, revised to reflect other changes that may have happened in the organization. So marketing plan is very important, and you should always have a marketing plan before you actually try to implement some type of new marketing initiative. So you don't want to go out putting up billboards if it's not in your marketing plan. You want to make sure that everything has been planned out before you actually do it. So with marketing, we definitely have a lot of responsibility that we have to consider, and we have to consider at 3 different levels. The individual level, the organizational level, and the societal level. So why might it be important at the individual level?
Safety for the customer.
Safety for the customer. We also don't want to offend, we want to keep our patient satisfaction scores high, right? So we definitely have to consider at the individual level. At the organization level, again, the organization, that's our brand, that's our reputation. If we are not ethical with our marketing, it could be detrimental to our organization, which could ultimately be detrimental to our jobs, right? You don't want to get fired. And then societal. You kind of touched on this earlier. We definitely don't want to offend a whole group of people or a whole culture or a whole religion, right? So we have to have consideration for each level when we're doing our marketing. We have to make sure that it's done ethically and that we haven't violated any ethical rules that we might have. So we're just gonna wrap everything up what we talked about today. I think that a lot of times marketing is overlooked in healthcare because when we think about healthcare, we automatically think about surgeries and procedures and patients, but without marketing, how will people know about our hospitals? How will people know about our physicians? How will people know where to go?
Or even
How will
services
people
you carry.
how will people know that there's a new hospital out on Rayford Road if they don't do marketing, right? So marketing is very important even in healthcare because we also have to make sure that we're communicating with our patients and our consumers to make sure that they see the value in using us or coming to our facility or using our doctors. And we also want to build those long-term relationships that I talked about earlier. And it's a lot harder to do that without marketing. Now, if you happen to, get into an organization and you're not working in the marketing department, as manager or as leader in your area, at times you may have to meet with the marketing specialist within your organization to get assistance on Let's say within your department, you guys are offering a new service. You may want to meet with a marketing professional or the marketing manager within your hospital, say, how can you help us get this information out that we're providing this new service, or that we're going to be open on Saturdays now from 8 to noon. Whatever it may be, you can always seek assistance from the people that do this every day within your organization to get help. But again, you just don't want to run out and try to take matters into your own hand without knowing if there's a plan for it in place within the marketing department. So does anybody have any questions or comments about marketing or what we talked about today? Make sure that you review the chapter